This module addresses California's mandated reporting laws. Physicians must report every patient diagnosed as having disorders characterized by lapses of consciousness. Lapses of consciousness involve a reduction of alertness or responsiveness to external stimuli, an inability to perform one or more activities of daily living, or an impaired sensory motor function used to operate a motor vehicle. Such conditions that require reporting to the local health authority include sleep disorders, abnormal metabolic states, seizures, dementia, and brain tumors. Your discretion is required when deciding whether or not to report a patient. Factors to consider include whether the lapse of consciousness is a one-time event or an ongoing medical condition, and whether you have enough information to make the determination. If there is not enough information, you may defer reporting until the diagnosis is confirmed. The following examples will help you determine if reporting is necessary. In our first example, a 35-year-old diabetic was taken to the emergency department after his family found him unresponsive. At initial evaluation, his glucose was 32. He said he used the wrong bottle of insulin due to being distressed over a breakup. He comes to you for follow-up. The emergency department did not report. Do you? Yes. If you don't know the patient, assess him for possible depression and lack of adherence, but there was a lapse of consciousness. You don't know if this was a one-time event, so you should report the patient. In our second example, a 75-year-old woman develops gastroenteritis after attending a church picnic. After 2 days of vomiting, she got up from bed and fainted. Her daughter took her to the doctor, who prescribed medication and fluid replacement, and she made an uneventful recovery. Do you report? No, you do not report. While she had a loss of consciousness, this was a one-time event and not associated with a chronic health condition. In this example, a truck driver admitted to having a seizure while on vacation. Besides this episode, he has not had a seizure in 5 years. On questioning, he admits he left his medication at home, but returned the next day and has not missed a dose since. He begs not to be reported because he'll lose his commercial driver's license, and this was an unusual circumstance. Do you report? Yes, you report this patient. You must report any loss of consciousness associated with an underlying condition. Next, a 19-year-old male was hit in the head while surfing and experienced a loss of consciousness for 10 minutes. He was immediately taken ashore and never stopped breathing. His friends drove him home, but he visits you the next day. He's oriented, and all exams and tests are normal. Do you report? No. While there was a loss of consciousness, it's unlikely to happen again. If you did report him, the DMV would probably take no action when they did their follow-up, since this was a one-time event. In this next case, your 80-year-old male patient comes to you after he was involved in a minor car crash. He tells you the police officer reported him to the DMV for re-examination. The patient says his vision has gotten worse over the last 6 months, and he wasn't seeing clearly at the time of the crash. Do you report? No. Vision is not a mandated reporting condition, and since law enforcement has reported the driver to the DMV, he's already in their system. Send the patient to optometry or ophthalmology to have his vision evaluated. In our final case example, an 83-year-old woman visits you for the first time after moving from New York to be closer to her daughter. She brings her medical records, which reveal a workup and a diagnosis of mild dementia. She is taking Aricept and still driving. Do you report? Yes. The DMV wants to know about drivers with dementia, even in the mild stage. Therefore, patients taking medication for dementia must be reported. However, there are certain situations where you are not required to report the impaired patients. You don't have to report someone you know isn't going to drive again, someone admitted to a long-term care facility, in a coma, or impaired to the extent they will never operate a motor vehicle. Or when the patient states they never intend to drive again and you believe them. So if that patient on Aricept says she lives with her daughter and will never drive again and you believe her, then you don't need to report her. Just document it in the chart. And finally, when there is documentation in the chart that you or another physician reported the diagnosis and the patient has not driven since. You can be held liable for civil damages if you clearly fail to report an impaired driver who causes a motor vehicle crash. However, immunity is granted to a health professional who reports the patient prior to a crash. In addition to the tragic loss of life and injury, litigation can result in costly financial settlements and legal expenses. Here are just 3 examples where an unreported patient later experienced an episode while driving that resulted in a death or injury. You are also required to inform patients of medications and medical conditions that can impair their driving, and notate this in the patient's record. Failure to do so could also lead to litigation. Documentation is critical. Record all referrals, recommendations, conversations, and reports in the chart. And be sure to include a do not drive prescription if you told your patient not to drive. So whose responsibility is it to report? Whether you are the emergency department physician, the hospitalist, or the primary care provider, the reporting responsibility lies with the clinician who identifies the reportable condition. When in doubt, the DMV would rather 2 physicians report than be unaware of a driver who may be impaired. To promote good reporting practices, it's important to know the policies of your institution. Designate an individual to complete the forms for your signature. Establish an internal process for documentation in the patient's chart, and include reporting in your QI/QA activities. There are several methods to report a patient. The confidential morbidity report form can be submitted to the local health department, who will forward this information to the DMV. Remarks are made in the Reportable Non-Communicable Disease and Conditions section. You can also report a patient directly to the DMV using the DMV Request for Driver Reexamination form. This form allows for a thorough description of driver conditions and behaviors. If you do not have access to either of the forms, a report can be submitted to the DMV or the health department on office letterhead. Health professionals are not the only people who can report. Law enforcement, caregivers, family, or anyone else can report a driver who they feel is unsafe. After the DMV receives a report, it's reviewed by a driver safety officer who has extensive training on medical conditions and their effects on driving. Their decisions are not based on age, but on driver ability. The goal is to offer licensing options that allow seniors to maintain their driving independence for as long as they can safely do so. After the initial review, they may take no action if they feel the case does not warrant investigation, such as in the case example of the surfer, had he been reported. They may take immediate action to suspend or revoke the license, effective 4 days from mailing the notice. Or the driver safety officer may schedule a re-examination of the driver. If the DMV requires more medical information, they may provide the driver with a medical evaluation form. This form is due in 24 days, depending on the individual case. Your patient will come to you with this 5-page form, the DS-326. They will complete the first page to self-report their health history, including current conditions, limitations, and medications. You will complete pages 2 to 5 to document the patient's health status. Page 2 of the form clearly asks for your opinion regarding the patient's ability to drive, and if you advise against driving. You may hesitate to respond to these questions, but no liability attaches to answering them. When reporting dementia, page 3 of the DMV form asks you to differentiate between mild, moderate, and severe cognitive impairment. The DMV's official position on dementia and driving is that some patients with mild dementia may continue to drive with enhanced monitoring. You will be asked to rate areas and degree of potential cognitive impairments, such as memory loss, diminished judgment, or impulsive behavior. Once the medical evaluation form is reviewed, the driver safety officer may take no action, or revoke or suspend the patient's license, but generally they conduct a follow-up interview to discuss the medical report. No action may be taken at this point, or the patient's license may be revoked or suspended. The DMV may impose medical probation and/or restrictions. The driver safety officer may also request a field test. Field testing can include vision, written, and driving tests. This is evaluated on a case-by-case basis. Once the driver has been to the field office for testing, they may pass or fail. If the driver passes, they may retain full driving privileges, or they may have some restrictions. For example, driving during daylight hours only, or having specialized equipment on their vehicle. They also may require more frequent monitoring. If they fail, they are considered unsafe to drive. Additional medical information may be required. The driver could be issued a special instruction permit to obtain professional driving instruction or further evaluation, or be asked to take additional vision, written, and driving tests. If a driver fails, they could have their license suspended or revoked. This decision can be appealed. In summary, the California Health and Safety Code mandates that physicians report disorders characterized by lapses of consciousness, which can include seizures and dementia, even mild dementia. Reporting can occur through the use of the CMR form, the DMV request for driver reexamination form, or on official letterhead. These reports can be submitted to the local health authority or directly to the DMV. You are considered negligent if you do not inform patients of medications and medical conditions that can impair driving. You can be held liable for civil damages if you clearly fail to report an impaired driver who causes a motor vehicle crash. Finally, although you are asked to comment on a patient's driving fitness, it is the DMV that determines the final outcome.